Hello, I'm David. I'm a pharmacist, and I'm here to talk to you about vaccinating different populations. And I'd like to talk to you about vaccinating adolescents. Now, vaccinating adolescents is incredibly important, and this is for a couple of reasons. First off, vaccination rates for adolescents as well as children has been on the decline in the United States and was particularly negatively impacted by the COVID pandemic. However, on the flip side, vaccination of this population has been shown to be incredibly effective. For example, HPV is probably one of the most effective vaccines that we have at our disposal in preventing things like cervical cancer and other types of conditions. We're also seeing more frequent outbreaks of vaccine-preventable conditions like meningococcal meningitis, as well as pertussis. Now, I do want to note that it's important to check with your state board of pharmacy, local state organizations, and other resources on your regulations around age limits for vaccination. However, I also want you to be aware that even if you live in a state or practice in a state that does have age limits, say you're only allowed to vaccinate 18 years and older, frequently states apply exceptions for adolescent vaccination, with HPV being one of the most significant examples, as well as meningococcal vaccine, where there may be provisions to allow you to provide that vaccine, say, down to age 14 or 11 or even 9. So, as opposed to other groups for adolescents, like older adults who may be frequenting your pharmacy for their monthly, their monthly medication refills, vaccine marketing opportunities are a bit different for adolescents, and it centers mainly around marketing to parents. And so some ideas that you could potentially take on might be doing marketing campaigns around back to school season to make sure that folks' kids are up to date on their immunizations to allow them to get back into school. Another great idea is to partner with local schools themselves to do, say, their annual flu vaccine campaigns or other vaccine campaigns, as well as local pediatric practices who may be stretched in terms of their ability to provide many of these vaccinations. And these would be a great mechanism to provide you with referrals. This is also helpful in states that may have strict age limitations for vaccination, as these providers can provide you with a prescription for these vaccines directly. It's also important to familiarize yourself with vaccine catch-up schedules for those who may be behind on vaccinations, and as well scheduling follow-up appointments may be important for certain vaccines like HPV and meningococcal, which may be a 2-dose or more series. So those are all important reasons why we should be vaccinating adolescents.